Hi, everybody. My name is Jeffrey, and today I will be presenting a historical timeline of cervical cages based on the research our group has done. To begin with, in 1955, George Smith and Robert Robinson conceived of the ACDF procedure, or anterior cervical discectomy and fusion. This procedure involves the removal of a disc in the neck and the use of a bone graft to fuse the surrounding vertebrae. It eventually evolved to be used in all cervical spine surgeries related to spondylosis after the 1990s, but before then, a traditional posterior approach was adopted when using cervical cages. By the 1980s, titanium and its alloys became the predominant material for cervical cages after long-time use in the orthopedic industry since the 1940s. The idea for cage fusion began in 1988 when Bagby proposed his bone basket to treat spondylitic cervical myelopathy in horses. Following this, DuPont-Acromed, a subsidiary of Johnson and Johnson, released designs for a cervical cage made out of PEEK, which boasted of radiolucency and an elastic modulus close to bone. Shortly after that, the back-C titanium alloy threaded cervical cage was released, whose screw design helped accelerate fusion and add stiffness, but ended up reducing stability and increasing subsidence risk. 1996 marked a big year when the FDA approved use of anterior interbody cages in the disc base, which provided a new avenue for spine fusion through an anterior approach as suggested by Smith and Robinson. By the 2000s, traditional box-shaped cage designs moved towards trapezoidal and wedge geometries, which complemented the vertebral endplate concavity and cervical curvature better. Finally, in 2014, Wenzel Spine released VeriLift C, a standalone cervical interbody fusion device whose novelty lies in the fact that its size can be expanded after installation, which makes it customizable and eases the installation burden during surgery. Although the history and the use of cervical cages only began within the last century, the numerous advancements in this field have allowed for a vast improvement in the patient quality of life post-surgery.